Hi, welcome back. It's Dr. Ken Chapman again. I'm going to take you on a tour of the ambulatory surgical center side of the facility here in Staten Island. So this side is separate and distinct from our practice side, and it's a ambulatory surgical center where we perform our procedures, our implants, or anything that you'd be concerned or need monitoring for. The patients would check in at the reception, take a seat here. We are going to now walk into the operating room area. Here is where people would register. We have bathrooms here. And then you'd have to click in with your ID and you enter here. This is the Article 28 section or side of the office. And we have our recovery PACU area. There's one exam room. So if patients needed to be seen while we were on this side, that is a possibility. Patients would enter here. We have changing rooms and lockers that will be assigned to them. Bathroom. This is our recovery area, and here we have 10 beds which can function as either pre-op or post-op. So we'll typically have 4 or 5 pre-ops, and the rest will be used for post-operative monitoring. Those chairs can recline into recovery beds. So within this section, we have our nursing station is where our physicians would typically sit, as well as nurses or fellows, mid-level practitioners, whoever it may be. And the OR area is back here. And so there are 3 operating rooms. Here's our sterile corridor. Our 3 rooms are here on our right. 2 of the rooms are essentially similar, and those are really meant to perform your typical minor procedures, epidurals, blocks, you name it. And here we have essentially an identical room. You can see we have neurotherm ablation machines and Stryker units. So within the practice, I think we have 4 or 5 neurotherms and 2 or 3 Stryker RF units. Not at this facility, but across them. Here's OR1, which is the main OR, which you have the capability to perform bigger cases in, such as implants, kyphoplasties, pumps. Sometimes they do endoscopic procedures here. We have a Zeem 3D unit, which essentially is a very fancy fluoroscopy unit that could do 3D images, as well as function as a CT scan. So it's a really neat machine that is probably underutilized by us at this point, as well as an anesthesia machine. And essentially, this is where we'll do a bulk of the stimulator implants, as well as pump implants. There's a whole network of rooms back there: locker room, kitchen, conference room, and another hallway with sterilization, clean, wet. There's a whole section that's not worth showing now, but this is the bulk of the clinical area that you will be spending your time. So I really wanted to thank you guys again for taking this quick tour for us, and it's a shame that we weren't able to have you here to see it for yourself, but we wanted to make sure that you were able to see and get a feel for the environment that you'd be in. All the best and good luck with everything.